If you're a technology buff, this next story will have you glued to the screen. New research being developed at the University of Maryland has huge potential to improve the future surgery residents, how they are trained, or even how police officers will respond to emergencies. CTV's Sonia Srivastava has more.
The University of Maryland College Park allowed the media to come inside this lab known as the Augmentarium, where great minds are at work on new technology that could transform lives. Amitabh Varshney, the director of the Institute for Advanced Computer Studies, says virtual and augmented reality have huge potential. So what is augmented reality? It's when you use real-time data in a virtual reality-like setting.
This would be a way in which we can use virtual reality to educate about spatial concepts such as how do molecules interact with each other, how does gravity change from one planet to another planet. You could not only see it, but you could experience it at a gut level.
Imagine a doctor looking down at a patient during surgery and being able to see details like blood type and the exact location of an aneurysm. Dr. Sarah Murthy, a surgeon at Baltimore Shock Trauma and an associate professor at the University of Maryland School of Medicine, says these new tools will change the way they train future surgery residents.
It's very difficult to train somebody in how to take care of multiple patients at once. And so one of the things that this very immersive virtual reality environment can do is train people to spin plates, is what I've called it in the past. Train people to be able to keep track of multiple different patients at once and process both audio and visual data correctly and rapidly so that the right decisions are made in the right sequence in several different patients all at once.
Augmented reality glasses could be used to stimulate surgical situations and give physicians hands-on training and practice before they have to operate on a patient.
I think it can expose trainees to very intense environments before they do it for the first time, so they get used to seeing an open femur fracture or maybe an eye injury, and so that they're not faced with that for the first time when they're in the position of having to take care of that patient.
And we're told that Dr. Murthy will actually start doing the user study with the headsets in the spring with some of the trauma residents. At the University of Maryland College Park, I'm Sonia Srivastava. Back to you all in the studio.
And the Augmentarium opened in December of 2014 after more than $1 million in funding, including a grant from the National Science Foundation.